Time to round up a big topic from the week. A Maine judge grants nurse Kaci Hickox the okay to go wherever she wants, defeating state officials in their efforts to keep her isolated. Hickox had refused to honor a voluntary quarantine. She said the confinement violates her rights. Hickox, who treated Ebola patients in Sierra Leone, says she has no symptoms and is no risk to the public. The judge says that as long as she is not infectious, she can go where she wants, but she should inform the state if she travels anywhere. So will this decision hurt or help in the fight over the best way to protect the possible spread of the virus here in the U.S.? That's our topic this half hour. We want to hear from you on Facebook, and you can also weigh in on Twitter. Be sure to use the hashtag Fox26 for life. Joining us live in the newsroom is our legal analyst, Chris Tridico. He heads up our esteemed panel. Chris, right decision by the judge in the case of this nurse?
Well, I'm going to get to that, but first, Sally, I just have to say I'm sure it was just timing that we didn't cover Sam Houston State's victory yesterday.
We covered it. We covered it. I know we covered it. But Texans take precedent on Sunday.
Battle of the Piney Woods is now the oldest college rivalry in Texas. So I just had to get that out there. And Sam Houston, of course, the best university in Texas, won again yesterday. Now, here's the issue with this Ebola. This has been emerging every week. We see every day we have a new crisis with respect to Ebola. And what the judge said the other day, when she got back and New Jersey quarantined her, I agreed with letting her go from that confinement. She was in a tent without a shower, without working water, without running water. And I think that's not only inhumane, unconstitutional to lock people up that way. They let her go back to Maine where she had agreed to stay in her house for the 21 days, then reneged on that and left the house. That's when the state sued her in an attempt to get this isolation in her home for that 21 days. The ruling, I think, when you look at the ruling, is probably proper. Let me introduce now our panel. Mustafa Tamiz, our political analyst, Jackie Bally, our public policy analyst. Jackie, I'm going to start with you. Okay. Letting her go from Maine was fine. I think that was totally unconstitutional. From New Jersey. Maine said, you know, stay in your house voluntarily until the 21 days is up. And she originally said yes. Then she said, no, I'm not going to do that.
Yeah, you've seen several states, they're trying to be more proactive and trying to quarantine some of the potential people who've been traveling to Ebola-infected countries. And what you're seeing in New York, for instance, they're actually compensating those who have been quarantined. So even though this was very proactive, because Ebola is still a mystery to some of us, it's a deadly disease, and the CDC, their laws are really on a voluntary basis. And if we trust that you're going to be honest, and we've seen in examples that some people are not honest, I can understand why they were so aggressive. Now, keeping someone in a tent, that's very questionable, because we do want to protect the welfare of the entire state, but we don't want an individual to give up their rights. So I do understand why they were so proactive, but I think releasing her and then saying, stay in your house for at least 21 days, I think that was the better remedy.
The judge initially in Maine signed an order saying you'll stay in your house, you can't leave without letting public health officials know. And then in his latest order said we can't have laws quarantining people based on hysteria.
And that's exactly what it is. The problem from a medical scientific standpoint is in West Africa. And in order to solve the problem in West Africa, we have to leverage American exceptionalism to cure the disease and ask our healthcare workers to go there to fight Ebola, because we live in a very interconnected world. 10,000 people are attracting Ebola every month. And if we don't try to solve the problem there and address only the hysteria in this country, then we're going to be in a lot more trouble, and healthcare workers have to feel free to go out there and do their job.
All right, let me go to Sally. She's monitoring our social media.
Take a look at a couple of the tweets that are coming in, because people are really divided over this nurse. I mean, people are sometimes really mad at her, including this one guy, Michael. He says she's a poster child for self-entitlement and a disgrace to a respected profession. Kristen says, I can't help but laugh out loud at the people who are mad at that nurse in Maine who does not have Ebola. She's not sick, therefore not contagious.
The problem I have with this, and I'm glad those tweets were the way they were, because that's where I was headed next. The problem I have with this is you find out you're contagious when you start running a fever, and you may be out when that happens. And that's that's where the fear comes from. And Jackie, back to you. The judge wrote in his latest order, the actions of Hickox as a health professional need to demonstrate her full understanding of human nature and the real fear that exists. She should guide herself accordingly.
Yeah,
and I think she's violated that.
I agree with the judge's statement. I agree with your statement. You know, it's the perception. Even though she does not have the symptoms, we were told by the CDC and by the administration that they did not think that Ebola would even enter the United States. We've seen different cases that it's done so. So people are, you know, in a fear. There is a fear there. There's a panic mode. And as a healthcare professional, she should know that we have that general perception. So even though she's not showing the symptoms, she should at least adhere and abide by the 21-day time period, so that we don't have that continued fear when she's out in the public.
Now, the order that's in place now that the judge issued last week says that she will not leave the state of Maine without letting anyone know. She'll continue monitoring her temperature and report all that.
As she has, and let's not forget,
real quick,
she volunteered to go there on her own and tackle this problem on ground, and now people are accusing that she's not living up to her medical profession. That's laughable.
All right, we're going to leave it right there. We'll be back in a little while with another really good story.
Okay, we will see you guys then. We appreciate it. Thanks. Let's send it over to Caitlin for a look at that chilly forecast.